Joining us now, former FDA Commissioner Dr. Scott Gottlieb. Dr. Gottlieb, we'll start at 20,000 feet and look at where coronavirus stands in this country. I believe there are certain hot spots. Are things getting better or worse?
Well, things are clearly getting a lot worse, and I think they're going to continue to get worse, unfortunately. There's epidemics right now in the Midwest and the Great Lakes states. You're seeing cases really build around the country, even when you look at places like Texas, which went through a very robust wave of infection, a surge of infection over the summer. They're seeing infections and hospitalizations build. Even here in the Northeast, we're seeing cases go up. I talked to 2 hospital executives in the last couple of days here in the Northeast, and they're seeing cases in their hospitals go up quite substantially in the last couple of weeks. And so we're seeing cases build around the country. The rate of transfer, the RT, is above 1 in about 40 states right now. So 40 states have an expanding epidemic, and I would expect that, unfortunately, to continue to build. I think by Election Day, we'll probably be at maybe around 60,000 infections a day here in the United States, 70,000 infections a day, back to the old peaks. More than 40,000 people hospitalized. Right now, we're at 37,000. We're going to be well above 40,000 by then. And tragically, I think deaths are going to start to go up. They're a lagging indicator of the infection.
Doctor, you predicted this was going to be coming for some time, that the fall was going to be more difficult. I'm curious, though, you look at almost a migration pattern of this illness. In the early spring, when it was still cold in the Northeast and across the North, a lot of infections there. Of course, much of that had to do with travel coming from Europe to New York City. Then, as it got warmer and people in the North got to go outside more, the infections seemed to go down, again, for different reasons, but for the most part went down there. But we saw problems in the Sun Belt from Arizona through Texas over to Florida. Now it's getting cool again. People are going back inside, and we're starting to see it. You can almost draw a straight line in most states above the Mason-Dixon line west, and that's where a lot of the hot spots are. Are we finding 6-9 months into this that so much of this really does have to do with the spreading of this disease when people are pushed inside because of climate?
That's certainly part of it, and that's part of what we think was going on in the South. People went indoors to get access to air conditioning when it got very hot in the South, and that's what propelled some of the spread down there. But I think what we're likely to see this fall and winter is more of a confluent epidemic across the entire country. Really, what we've had to date is state-based actions, state-led actions on this virus, trying to combat it with regional effects. We've seen regionalized epidemics. We haven't had really a truly national epidemic where you've seen simultaneous spread in all 50 states, like you do often with the flu season. Flu starts as a regionalized epidemic, then it becomes more confluent across the entire country. I think that as we enter the fall and the winter, we're likely to grapple with a situation where really every part of the nation is going to be lit up by infection. The exception is going to be cities where you've had a very dense epidemic, where you're not going to see the same rate of transfer, but you're still going to see spread there. So cities like New York, Miami, Houston, they're not impervious to second waves, but presumably the second wave won't be as vigorous as the first because they maybe had 20-25% of their population already infected. So the rate of transfer is just going to be a little slower in those parts.
Dr. Gottlieb, good morning. It's Willie Geist. Good to see you. I don't want to put you on the spot of making formal recommendations, but Dr. Fauci was asked a couple of days ago how he's thinking about Thanksgiving. And it's a conversation that's happening in almost every family in this country right now. Should people come in from out of town? Should they be flying in? Should they be gathering in large groups? So how are you thinking for your own family about Thanksgiving, and how generally do you think Americans should be thinking about gathering about a month from now?
Yeah, I mean, unfortunately, we're going to spend it apart this year. We've already started to think about it. I have older parents that, you know, I'm not sure that I would feel comfortable bringing them around a lot of young kids right now. They've made it through the epidemic so far, and I want to be careful. I think we're in the final stages of this, really the sort of pandemic phase of this. I think we have to get through the fall and the winter, and as we enter into 2021, things will start to look better. We're going to have better therapeutics, hopefully access to a vaccine. Hopefully this starts to become a little bit more of a seasonal type of spread that it it dissipates a little bit as we enter into the spring and the summer, so we have a little bit of a breather before we enter into the fall season in 2021 and have access to a vaccine. So I think Americans need to recognize we have some hard days ahead of us, but we're going to get through this, and this is going to be largely a 2020 event, and as we get into 2021, things will start to look better, so we just need to be careful. Final point is I talked to a number of state officials over the last couple of days to ask them where they're seeing the spread emanate from. Is it bars? Is it restaurants? And what they've said to me is when they do their tracking and tracing, they're finding that it's family gatherings, people getting together in groups of 10 or 20, letting their guard down. So I think people need to be careful in those settings, too.
Well, I guess that answers my question about Thanksgiving. Dr. Mike Barnicle has a question for you. Mike?
Doctor, there seems to be some confusion in this country about the word immunity when it is applied to the virus. And part of it is rooted in people who claim to have beaten the COVID virus, got the virus, beat it, they're better, and they now claim to be immune from it forever. Is that accurate?
No, it's not accurate. I mean, there's going to be a period where you probably have some immunity to the virus. It's going to be highly variable, but I think we could figure that for 6 to 12 months after you get the virus and you beat it, you probably have a period of immunity. But it's not what we call sterile immunity, meaning you can get reinfected. You just are unlikely to get as severe a course the second time. But that immunity is going to wane over time. You'll have some residual immunity where you'll have protection against having a bad outcome. You'll have what we call T-cell immunity and memory B cells, but the antibodies dissipate over time. The other thing to think about is that when people get these antibody drugs, there is a risk that there's a potential or theoretical risk that when you get one of these drugs, you basically shortchange your own immune system. You're getting an intact immune system in a bottle when you take one of these antibody drugs. And so it could be the case that your body never really mounts a full immune response because it never has to, because you've sort of supplanted your own immune system. So people who get one of these antibody drugs should be, I think, extra careful in thinking about the fact that they may not have gone through the disease in a normal way and developed the same kind of immunity as someone who beat the disease, if you will, because the reason why they would beat the disease or what helped them was one of these drugs.
All right, Dr. Scott Gottlieb, thank you very, very much. Boy, Joe, things are getting a lot worse.
Well, you know, though, some hope, too, and I think that's very important. Willie, just to summarize what the doctor said, and he's obviously one of our favorite guests on this issue because he always talks straight.
Yep.
What he has said is proven to be correct time and again. He predicted this was going to get worse in the summer and even worse in the fall. But this is just a summary. He did say that things are a lot worse right now. He also said they were going to get worse as we move into the fall. But he said, and this is hopeful, he said this is a 2020 event. For the most part, we'll look back on this as a 2020 event. We're improving therapeutics as things warm up in 2021. Hopefully, we're going to be moving through the pandemic part of this event. And by the fall, when we have vaccines, we're going to be able to stay out there. And finally, and I know you were probably surprised by this, this is such a contagious disease, such a deadly disease, that what Dr. Gottlieb says epidemiologists are finding, what scientists are finding as they research this disease, is that it is spread mainly in family groups, 15 to 20 people who let their guard down, and it spreads through family groups as well as whether you're in a restaurant or not. So you just can't you can't let your guard down even inside your own home. Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.